So you brought up something else. So you talked about marijuana being laced with other types of drugs. What about this whole idea of criminalizing addiction? I know people who get, especially if they have a crack problem or a heroin problem, one of those drugs that are very, very mind altering and controlling. And unless you have some sort of treatment or intervention, you're going to continue to get arrested for possession of crack cocaine and possession of heroin, right? So what about this idea of criminalizing addiction? If someone comes in for possession and it's pretty evident that they have a substance abuse problem, why are we sending them to prison and not to treatment?
You are 100% correct, Sandra. And not only do we do that for people who are addicted to drugs, but we do that to people who have profound mental illnesses. We basically treat their mental illness by sending them to prison and magically expecting that all the problems that they had that brought them there in the first place are now corrected because that person doesn't want to go back to prison. It's absolutely ridiculous the way that our system does the same thing over and over again that doesn't work. But nobody ever takes the bull by the horns and stops it. The reason why is because people are making money off of that.
Yes.
People are making money off of the fact that we dig our head into the sand and ignore the fact that a large portion of the crime that's committed is committed by drug addicts who are under the influence and are under the power of a devil that most better hope they never understand. And unless you have seen somebody who is addicted and consumed by an addiction, I don't think you truly understand the power of that. And nor do you truly understand the fact that sending somebody to a state prison is not going to ever fix that problem.
Solve that problem, yes.
We have got to implement, we got to switch. And again, you talk about defunding should really be called redistributing.
Yeah.
We need to stop spending the money on private prisons, and we need to start spending the money on mental health. And that needs to be our next revolution for the treatment of drug addicts, as well as those who have mental health problems, bipolar disorder, schizophrenia. Yes. Okay. My clients, 70% of my clients have a mental health problem that is gone untreated because they were that 9-year-old kid that you're talking about, Sandra. That 9-year-old kid who started getting involved in the system probably has a severe mental health learning disability and a mental health disorder that no one was able to get him treatment for because it's next to impossible to be poor and get and manage your poverty. You have like 4 different caseworkers to make anything happen. It's next to impossible. People give up. You can't blame them. This has to stop. And so we have to stop doing the same things over and over again that don't work. I'm a person who takes the bull by the horns. I know how to make things happen. I know how to get things moving. And I know how to put together a team to implement this in the future. And I'm going to start the next mental health revolution in this county to make us a national model of what criminal justice reform should really look like.